Gage Primar here, crushbackpain.com. In the previous video, we went over two piriformis syndrome exercises that target the gluteus medius and the gluteus maximus. As we discussed, it's a common finding in people with piriformis syndrome to have weak gluteal musculature. So that's why we're targeting these muscles, because making them stronger, making them contract efficiently, improving the endurance of these muscles can help reduce sciatica symptoms that come from piriformis syndrome. So the exercises that we discussed in the previous video, you want to stick with those for about 2 weeks. If those exercises have helped reduce your sciatica symptoms that come from piriformis syndrome, then you're going to want to progress to the 2 drills that we're going to cover today. The drills that we're covering today continue to target the gluteus medius, gluteus maximus, just in a different way. They're a little bit higher level. So the drills in the previous video work those muscles, get them contracting, and now we're going to take you, put you in a standing position instead of down on the ground, and make those muscles work in an upright, weight-bearing position. The first drill is a squat. Squats are really simple, but they need to be done correctly, especially in this case, because we want to target the gluteus maximus and the gluteus medius. So for this drill, it's a squat, pretty straightforward. You're going to get your feet shoulder width, maybe slightly wider than shoulder width. You just want a good, comfortable stance where you feel like you can squat effectively. The key to the way that you're going to squat with this drill, you're going to keep your knees out. So when you squat down, you don't want your knees coming in like this at all. That's going to put more stress, strain, stretch through the piriformis muscle and more tension on the sciatic nerve. So what you can do is you can actually consciously push your knees out as you squat down and then come up. And as you come up, you just tighten up the buttock muscles, the gluteal muscles real tight. So you're literally actively pushing out. And this starts way down at the feet. So you're pushing your feet out like you're trying to slide them apart. Now when I do that, I can feel my glute muscles activate. And then you want to keep that pushing out as you squat down and stand up. And you really focus on pushing out. And you'll feel it's a lot different than just doing a squat. So if I don't do that, I just kind of relax and I just squat down and come up, I don't feel my glutes working at all. If I start down at my feet and push out hard, like I'm trying to push my feet apart, I feel my gluteal muscles activate right away. I can feel them working. And I keep that outward lateral pressure as I squat down and stand up. So you're doing a squat, but you're pushing your knees out, pushing your feet out, and as you stand up, you exaggerate and really tighten the buttock muscles. So you want to do this squat in that specific way. And you're just down and up. And as far as how far down you go, you want to get down, try to get down around parallel to where your thighs, your femurs parallel to the ground, but you don't have to go that deep. You go down as deep as you feel comfortable, come back up. Down as deep as you feel comfortable, come back up. What you really want to focus on is keeping the feet pushing out, keeping the knees pushing out. That's the most important part. With the squat, you're going to do 10 to 15 reps, and you're just going to really focus, like we already talked about, on pushing those feet apart and pushing the knees apart all the way through the range, and then tightening up the glutes as you come up. 10 to 15 good reps. The next drill you're going to do is more of a single leg drill, and we're going to do it on the side that you're symptomatic on. So previously we talked about having piriformis syndrome, sciatica symptoms on the right. So I'm going to show you this drill on the right side. You're going to do it on whatever side you have piriformis syndrome on. So this drill is more or less a single leg drill, and you're going to just kind of get set here, and you're literally just going to come out, tap the heel, and come back. So it's kind of like a little single leg mini squat type drill. So you're just down and up. The key with this drill is you're not letting your femur, your thigh come in. You're not letting it rotate, so it doesn't look like this. You're not just going real fast, and you're not letting the pelvis drop. You're not letting your waist drop. So the waist, your pelvis stays parallel, stays level to the ground, and your femur stays here. This doesn't happen. So you want to think about tracking your knee over that second toe, and you just come down and up. So this, you want to really focus on not letting this happen. Just like that. And with this drill, we're thinking quality of movement over quantity. I would say 6 to 12 reps, and it's not as easy as it looks. I'm having to really concentrate on not letting my femur kick in or rotate in, but we're making the glutes work so the piriformis isn't overworked, and then that way the sciatic nerve isn't compressed, it doesn't have excessive tension through it, so then it's less symptomatic. So you've got the squat, 10 to 15 good repetitions, doing it in that very specific manner where you're activating the gluteus medius, gluteus maximus, and then you have this little single leg kind of mini squat or single leg. It's kind of like a pistol, but you're not going through a full range of motion, and you're just really focusing on keeping your waist parallel, level, and you're not letting your femur kick in or internally rotate. 6 to 12 repetitions. Do these drills twice a day. Stick with them for 2 weeks. And if your piriformis syndrome, your sciatica symptoms are continuing to improve, check back with me for the next video. I'm going to show you how to progress this program. I'm going to show you 2 new drills that you're going to start to bring this along even further and hopefully just completely knock your piriformis syndrome out. If this video helped you, if you liked it, leave me a thumbs up below, leave me a comment. Also, let me know what questions you have on piriformis syndrome, sciatica, anything that has to do with lower back pain, and I'll do my best to answer those questions here on the Crush Back Pain YouTube channel.